I'm Peter Block here at ACC 2019 in New Orleans, and with me on the left is DK Oji from Nigeria. And DK has just presented a trial concerning hypertension in black people in Africa. An interesting trial. DK, tell me about your trial.
Now, in spite of the fact that high blood pressure is very common in sub-Saharan Africa with a lot of complications, we don't know the best combination amongst contemporary combination therapy that we have. Some combinations that are commonly used are amlodipine hydrochlorothiazide. We also use amlodipine and ACE inhibitors, and also use ACE inhibitors and ethiazide. But we don't know the one that is most efficacious. So we wanted to know, amongst these three combinations, which is most efficacious.
Okay, so three combination therapies. Actually, fairly usually used. Perindopril is one that I guess is fairly common. And the outcomes seem to favor that perindopril is a helpful drug in these patients. But I'm going to let you tell me what you think the outcomes really are here. What's the message out of these three groups?
The message out of it is that the combinations containing calcium channel blocker, amlodipine, were more efficacious compared to the perindopril hydrochlorothiazide. Right. So the amlodipine hydrochlorothiazide and amlodipine perindopril combinations were more efficacious compared to the perindopril.
So it's the perindopril and amlodipine which seems to have a lot of effect. Is that a fair statement?
Yes, it's a fair statement, but also amlodipine hydrochlorothiazide also had very good control in terms of blood pressure.
So maybe it's the amlodipine that really is making the difference here.
Yes, I think so.
Okay. Are there any other parts of this trial that are important? Now, I know that in looking at the data, which I have done with you, that the whole issue of side effects also comes in. Because obviously a physician has to say, okay, which of these combinations am I going to use? What about the side effects? Does that impact the decision?
Yeah, right. That is very important. So in choosing between amlodipine hydrochlorothiazide and amlodipine perindopril, I think the physician should consider the side effects. One interesting side effect we found out for those that were on amlodipine hydrochlorothiazide is that they had hypokalemia with potassium less than 3.2 in about 5.3% of them.
Okay, so the potassium issue really is an important one.
It's very important. So in using this, maybe the physician should consider checking the potassium more regularly, and also maybe using potassium replacement therapy or using more vegetables and bananas and things that could.
Okay, so would you use potassium replacement therapy at the front end, or would you wait and see what the potassium does?
No, wait and see what the potassium does. And that is why the physician should check the potassium more regularly in people that are going to place on amlodipine hydrochlorothiazide.
Okay, so now I know this is in sort of Central Africa that you did.
Sub-Saharan Africa.
Sub-Saharan Africa.
So 4 regions of Africa: Central, West, South,
Understood.
and East. Yeah.
Does this relate to black people in the United States, black people in the Far East?
It's difficult to completely extrapolate because, of course, as you know, disease is a mixture of genes and environment. But it's possible. I think we might need a trial between blacks in sub-Saharan Africa and African Americans to really answer this question. Yeah.
So there you have it. The trial is going to ask for another trial probably in the long run.
Yes.
But to test the combination, it's clear that amlodipine is a winner, number one, and perindopril with amlodipine, a particularly good one.
Yes.
But watch out for the side effects. We're going to have to check with that to make sure that we fix the right combination for our patients.
Yeah.
Fair enough?
You're right. You're very right.
Thank you, DK.
Thank you very much. It's a pleasure.